Hi everyone, today we have several fourth-year medical students here to share their favorite study resources for family medicine, the study schedule they used on their rotations, as well as general tips so that you can do well on your third-year clinical clerkships. What study resources do you recommend for this rotation?
So family medicine was my favorite rotation because I think you just get to see the full breadth of medicine. But that said, that's part of what makes that shelf so hard. I think of all the shelves, this was the hardest one to study for, just because it's like, what do I study? All of it? Yes. So UWorld doesn't have a set-aside section for family medicine, which makes it not the best resource, I don't think, for family medicine. I think you can try to pick and choose certain questions from UWorld for it, but it's tough. Derm from UWorld is good, I think, for family, and then if you haven't done OB or peds yet, a couple of those might be helpful, just doing a block or two of those. We did Roche Review. Our course director had a subscription, and so we would do questions together in our didactics. I thought those were pretty good with good explanations. And then AMBOSS I thought was really good for family medicine. I just did the free trial, so it's like a week, and I did it a week before my shelf and tried to get through as many questions as I could, so you can use the free trial. I ended up buying a month subscription for step 2 just because I liked it so much for family medicine. And yeah, just paying attention to your patients and the most common chief complaints they come into clinic with, because that's what comes up on the shelf. Chest pain, COPD, vaccinations again, just like in peds, those sorts of things. You're going to be tested on them, so just know them.
I basically tried to finish the internal medicine UWorld questions that I didn't get to while I was actually in the block for IM. I did just kind of like a random sort of smattering of online med ed lectures covering all of the different internal medicine topics, because family medicine is sort of broad and it kind of does cover all of IM and a little bit of peds. So I did that, and I did all the MBMEs they had. I think there were only 2 for family medicine. And because there was no specific section for family med on UWorld, and there's no specific section for family medicine with online med ed or with like Emma Holiday, she doesn't make a video for that. That's one of the rotations where I think it would be good for you to get one extra resource. So the one I used was pre-test. A lot of my fellow classmates also used pre-test and liked it. Some other people used case files and they really liked it too. But I think family med is one in particular that you should probably try and get one extra resource for, because it's a lot of material, it's a big shelf, and I just don't think there's enough material with the other resources to cover it all.
Family medicine also has a step up to medicine, which I rented, so I don't have it here. That was really helpful. A lot of family medicine shelf is particularly based around like ethics questions or like screening people, so learning the screening deadlines from like I think it was the AAFP is super important. Just drilling yourself on that, making flashcards of it the first day, and then just doing it. Hopefully that's what you're practicing with your doctors anyway, but just knowing that information is super important.
Family medicine, content-wise, is kind of similar to internal medicine, just because you're covering kind of a wide spectrum of diseases and things you need to know. But case files, pre-tests, and UWorld, like all the other rotations, helped, as well as, forget the name, but it's like the American Family Practice Association. Online, they have some practice questions and resources for medical students. In addition to that, the family medicine shelf is pretty heavy on what the guidelines are for different screening tests. So going to the United States Preventative Task Force website, they have a kind of a chart that goes through all the different guidelines, and they're basically going to ask you that on the shelf. So it's pretty high yield to kind of go through that and maybe make some flashcards and memorize it.
Family medicine is a difficult one. It was my first rotation. And that's a really hard rotation to start off on if it's one of your first ones, because it just covers so much breadth. For questions, I did UWorld, specifically the MSK and the biostat sections. I didn't do all of medicine because there was way too much information, a lot more inpatient, like internal medicine style questions, which wouldn't have been useful for family medicine. In addition, I did pre-test for family medicine. I felt like that really saved me, because it actually gave me access to all these questions that would be on my shelf. I also read the Step Up to Medicine ambulatory section, which was really helpful.
Family medicine, I think, is the most difficult one to study for because it's one of the most broad tests. I would say Step Up to Medicine as a book is fantastic for all of medicine, and at the back of the book there's an ambulatory section, and that covers most of the guidelines of the United States Preventative Health Task Force puts out, and those are big points on the NBME test. I would also recommend doing the MSK section, the musculoskeletal section of UWorld, to do well on the test. But that's probably one of the hardest tests because it's so broad. It covers almost everything. There's OB-GYN, there's peds, and there's medicine on it.
How did you schedule your studying for this rotation?
Family was tough for me because my last 2 weeks of family medicine were inpatient, and so I had really, really long days. I still tried to study at the end of those days, but I don't know how great the quality of that studying was. Knowing that my last 2 weeks were going to be inpatient, I really front-loaded the studying the first 4 weeks. Our family medicine rotation 6 weeks. Studied a lot on weekends, studied a lot outside of clinic. During that time, I had a Firecracker subscription. Firecracker's not my favorite resource personally, but it was nice because you can do it on any computer or on your phone. So on downtime, I was doing Firecracker flashcards. But for the most part, it's the same as anything else. Just study when you can and look ahead in your schedule to see when you might have some really tough times and try to plan ahead for those.
I was lucky. I started earlier, and so that meant I got off a little bit later. We started seeing patients at 7 a.m. in my clinic, which meant I usually would get out at like 3. And I was about a 30-minute drive from the clinic, so I'd get home around 3:34. So that was pretty early in the afternoon, and that gave me some time to really try and hammer down on those IM questions that I didn't finish and really go over the other material the best I could. It's like I said, it's hard because there's no specific section for family medicine, so you kind of have to go broad with it and touch on a lot of different topics while you're doing it.
Studying family medicine's a little harder, or was harder for me because our clinic was packed. I was able to study during lunch, and then as soon as I got home, again, it's clinic hours for the most part, so you are able to go home and study afterwards. It's at the end of the year for me, so I was just like really tired whenever I went home, but you gotta do what you gotta do. It was fine.
My medicine, again, is one of the rotations that aren't as busy as the other ones. So I had I would usually get out of clinic around 5 or 4 and have time to study after that, where I would just make sure I'm doing my practice questions every day, make sure I'm reading. And then even sometimes there'd be breaks in between patients at clinic where I would just try to read or do some questions.
Family medicine was another primarily outpatient rotation for me, although I had 2 weeks inpatient. So I started studying on day 1 because family medicine especially is one of those rotations where you have to know so much. The shelf is like supposed to be a pretty difficult shelf, and I thought it was. So start studying early. My inpatient rotations were like week 4 and week 5 out of a 6-week rotation, so I knew I would get less time to study during that time. So I started studying early. I studied on weekends when I was in the clinic because I had time off. And then when I was inpatient, I was kind of okay with taking some time not to study because I studied harder kind of earlier on.
I really struggled actually to study for family medicine. I read all of the ambulatory section of family medicine. I broke that up over 2 weeks and I read the entire thing. And then I broke up the questions from UWorld for the MSK section and then a couple of maybe like a 100 or 200 internal medicine questions from UWorld as well. The AAFP also has questions that I'd recommend doing.
What general tips would you recommend to do well on this rotation?
I say don't underestimate family medicine. I think a lot of people go into it thinking it's going to be, just boring, outpatient, and maybe for some rotations it's like that. For where I was at a county hospital. We got to do procedures, so knowing how to suture and how to tie came in handy for me. I got to do some suturing, got to do paracentesis, circumcisions, things like that. It's just a mixed bag of everything. And no matter what specialty you're going into, I think that there's something to glean from family medicine. And so even if it's not an interest of yours, primary and preventive care, just going into it with the mentality, what can I take from this to apply to the specialty I'm going into, will be good for you and will make the rotation not as painful if it's not something you're super passionate about. And I think that goes really for every rotation, but particularly for this one. I hear a lot of smack talk on family medicine.
Like I said, try to maximize your study time. I think the schedules are typically a little bit lighter so that you can cover a little bit more each day. Try and go through all of the material that you can. It's a very broad topic, so that may not be possible. But in family med, I thought one of the best things about it was the fact that we were seeing so many patients every single day, and I was just practicing my interview skills, my physical exam skills, and my presentation skills. So I just got a lot better at sort of picking up on what are the most common things people come up with or come to the clinic with, and what sort of things can help differentiate those common diseases that people come up with a lot.
Family medicine's a great opportunity to study for step 2 in general because it's a little bit of everything. You have to know peds, you have to know OB, you have to know IM. So using that time wisely and not just studying for the family medicine shelf, but kind of like creating a little step 2 plan for yourself during that time it just like makes it a better use of time.
The United States Preventive Task Force guidelines, those are really, really high yield, so make sure you're studying those and just make sure you're doing, you're going to be in clinic. Most of us won't be in the hospital when you're doing that. So it's kind of a different setting. Most of the patients are known to the clinic for a long time, so it can be kind of weird seeing them. They're used to seeing their regular doctor. But everyone was really nice and just making sure you're studying every day.
Family medicine, I'd recommend knowing your vaccination schedules and knowing your USPSTF guidelines. So these are really important for your shelf as well as just in real life in the clinic. You need to, that's something that you're going to get pimped on vaccinations as well as knowing what kind of tests each healthy person that comes in needs to know. In addition, I'd recommend honing in on your MSK skills, knowing all the random tests like Hawkins and Neer's test, and knowing what to do with people that have very bread and butter problems, such as MSK pain, back pain. Case files I felt was also very helpful, especially because you have less access to UWorld for family medicine. I'd recommend case files for those bread and butter cases.
Be prepared to talk to patients who don't really want to be there. You talk to a lot of patients who they just go to their visit and they want to get in, they want to get out. But you also talk to a lot of patients who treat this visit as an airing of a lot of grievances that they have, and they're not just medical grievances, they're other grievances. So I think that you have to be a good listener, and that was the best part, and that was the hardest part of family medicine, is being able to sit there and listen and give the patients their time. And you have to and in my opinion, I think you have to also remember that you're in someone else's clinic, and that these clinics survive, and these doctors and NPs and PAs, they do well by providing good service to the patients and making sure the patients come back because they like the clinic. So you are also there to make sure that you provide that same standard of care and that same empathy and that same caring that the docs that there do, and that the NPs there do, and that the PAs there do. So you have to really be there for them as well.